Have you ever felt dizzy, numb, or confused, then brushed it off as just getting older? For many seniors, these are the silent stroke signs doctors say you should never ignore. I'll show you the 5 warnings, counting down from number 5 to the number 1 sign that can save your life. I'm here as your senior health educator, reviewing medical research to help keep you safe and independent. Before we start, this is general education, not personal medical advice. If you experience any of these symptoms, call 911 immediately. Don't wait. Don't drive yourself. Call for emergency help right away. Here's something that might shock you. Every 40 seconds, someone in America has a stroke. But if you recognize these signs within the first 3 hours, doctors can often prevent permanent brain damage completely. Let's count down the 5 silent stroke signs seniors ignore most, starting with number 5. Number 5, sudden vision changes. This means blurred vision that comes on fast, losing sight in one eye, or seeing double when you never had this problem before. Here's what's happening inside your brain. A stroke blocks blood flow to the part of your brain that controls vision. Without oxygen, those brain cells start dying within minutes. You might think it's just your glasses prescription or tired eyes. But stroke-related vision changes feel completely different from normal vision problems. They're sudden, not gradual. They don't improve when you clean your glasses or blink hard. Normal aging vision changes happen slowly over months and years. Most seniors I talk with say they waited hours or even days before getting help. They cleaned their glasses multiple times. They figured they'd see better after rest. But stroke vision changes don't improve with any of these things. They often get progressively worse as more brain tissue is damaged. Here's your simple vision check test. Cover one eye, then the other. Can you see clearly out of each eye separately? Try reading something across the room with each eye. If one eye suddenly can't see as well as it could this morning, that's an emergency. Now try this test. Hold your finger at arm's length in front of your face. Can you see it clearly with both eyes? Move your finger slowly left and right. Can you follow it smoothly? If your eye movements feel jerky or you're seeing double, call 911. Margaret, 74, woke up with blurry vision in her right eye. She figured she'd slept wrong and waited until afternoon to call her daughter. By the time she got to the hospital, she'd had a full stroke. The doctor told her family that if she'd called 911 immediately, they could have prevented most of the brain damage. Remember, vision changes from aging happen slowly over months. Stroke vision changes happen in minutes or hours. If your vision suddenly gets worse, call 911 immediately. Have you ever dismissed sudden vision changes as just tired eyes? That could be a dangerous mistake. Number 4, slurred or garbled speech. This means your words come out jumbled. You can't find the right words, or people can't understand what you're saying. During a stroke, the brain areas that control speech lose oxygen. You know what you want to say, but it comes out wrong, or doesn't come out at all. There are different types of speech problems during stroke. Your mouth muscles might not work properly, so words sound slurred. Or you can't find words. You might say thing when you mean spoon, or struggle to put sentences together correctly. The dangerous trap here is that many seniors think they're just tired or having a senior moment. They figure they'll speak better after rest or coffee. But stroke speech problems don't improve with rest. They often get worse as more brain tissue is damaged. Here's your speech check test. Try saying this sentence clearly. The early bird catches the worm. Can you say each word distinctly? Now try toy boat 3 times fast. Ask someone nearby if they can understand you perfectly. Try repeating your full name and address. If your words are slurred or you can't find common words, call 911 immediately. Here's another test. Try singing Happy Birthday or saying the alphabet. Sometimes singing works when regular speech doesn't because it uses different brain pathways. But if you can't do either clearly, that's an emergency. Frank, 69, noticed his words were coming out funny during dinner with his wife. When she asked him to pass the salt, he said something garbled. She asked if he was okay, and he said he was just tired from yard work. They decided to see how he felt in the morning. By morning, Frank couldn't speak at all. He'd had a major stroke overnight. The doctor said those first slurred words were his brain calling for help. What makes this tricky is that speech problems can come and go early in a stroke. You might speak clearly for a few minutes, then have trouble again. These are called mini strokes, and they're warnings that a bigger stroke is coming soon. Don't wait to see if speech problems improve. Stroke speech changes are a medical emergency requiring immediate treatment. Number 3. Sudden weakness or numbness in your arm or leg. This usually happens on one side of your body. Your arm feels heavy like it weighs 50 pounds. Your leg feels disconnected. You might not be able to lift your arm over your head, or you drag one foot when walking. This happens because stroke cuts off blood to brain areas controlling movement and sensation. The weakness can range from mild clumsiness to complete paralysis. You might just notice one hand feels clumsy buttoning your shirt, or it might be so severe your arm hangs limp. The numbness feels like your limb is asleep, but it doesn't get better when you shake it out. Most seniors think they pulled a muscle, slept wrong, or pinched a nerve. They figure the weakness will work out with gentle movement. But stroke weakness doesn't improve with stretching or massage. It often gets worse as the stroke progresses. Here's your movement check test. Raise both arms over your head like you're celebrating. Hold them up for 10 seconds. Does one arm drift down or feel much heavier? Can you keep both at the same height? Try this leg test. Stand and march in place for 10 seconds, lifting your knees high. Does one leg feel weaker? Try walking heel to toe in a straight line for 10 steps. Are you dragging one foot or veering to one side? Here's a coordination test. Touch your thumb to each fingertip quickly on both hands. Is one hand much slower or clumsier than the other? Dorothy, 71, woke up with a numb left arm Saturday morning. She figured she'd slept on it funny. She went about her morning routine, but noticed her left hand felt clumsy, turning newspaper pages. By noon, numbness had spread to her left leg. She finally called her doctor's office, but it was weekend. The nurse told her to call 911 immediately. At the hospital, doctors confirmed she'd been having a stroke for hours while doing her normal Saturday activities. Here's what's dangerous. It might start mild and progressively worsen. You might first notice your hand feels clumsy, then your whole arm gets weak, then your leg gets involved. Each hour of delay means more brain damage. Try smiling in the mirror. Does one side of your face droop? Try raising your eyebrows. Do both sides wrinkle equally? Facial weakness combined with arm or leg symptoms requires immediate emergency care. Remember, sudden one-sided weakness is never normal aging. Normal aging affects both sides equally. Stroke weakness is sudden and one-sided. Which of these signs have you experienced? Don't wait to act if you're having symptoms now. Number 2, severe dizziness or loss of balance. This isn't mild lightheadedness when standing up too fast. This is room spinning, grab the furniture, fall down dizziness. You feel like you're on a boat in the rough seas. The floor seems to tilt, walls appear to move, or you feel like falling, even sitting down. This happens when stroke affects the cerebellum or brainstem, brain areas controlling balance and spatial orientation. These areas tell your brain which way is up and coordinate your movements. Without oxygen, you lose balance and spatial awareness. The dangerous part is that 80% of seniors mistake this for inner ear problems, low blood pressure, or medication side effects. They sit down and wait for it to pass. They drink water, thinking blood sugar might be low. But stroke dizziness doesn't pass with rest or food. It often comes with nausea, vomiting, or trouble walking. Here's your balance check test. Stand with feet together, arms at sides. Close your eyes for 10 seconds. Can you stay steady without swaying or grabbing something? If you feel like falling with eyes closed, that indicates a balance problem. Try walking heel to toe in a straight line for 10 steps, like walking a tightrope. Have someone nearby for safety. Are you stumbling or veering to one side? Try this head movement test while sitting. Slowly turn your head right, then left. Does the room spin or do you feel nauseated? Look up toward the ceiling, then down toward the floor. Does this worsen dizziness? This next sign gets mistaken for aging by 80% of seniors, but it's actually one of the most dangerous stroke warnings. Robert, 76, felt dizzy getting up from his recliner Tuesday evening. He grabbed the chair arm and sat back down, thinking he got up too fast. 10 minutes later, he tried again and fell in the hallway. His wife helped him back to the chair, thinking his blood pressure medication was making him dizzy. When he tried walking to bed, he was so unsteady he had to hold walls. Around midnight, he got up for the bathroom and fell hard, hitting his head. He also vomited, making his wife think he had the flu. Wednesday morning, he couldn't get out of bed without falling. His wife finally called 911. The paramedic said the dizziness, falls, and vomiting were stroke signs that had been progressing over 12 hours. What makes balance problems especially dangerous is fall risk. When you're dizzy and unsteady, you're likely to fall and injure yourself. Hip fractures and head injuries can happen during stroke falls. The nausea and vomiting with stroke dizziness happen because your brain's balance center connects to the area controlling nausea. When balance is disrupted, your brain thinks you've been poisoned and triggers vomiting. Severe sudden dizziness, especially with nausea, vomiting, or falling, is a stroke emergency. Don't assume it's inner ear problems or low blood pressure. And the number one silent stroke sign seniors ignore most. Number 1. Severe sudden headache or confusion. This is either the worst headache of your life or sudden mental confusion where you can't think clearly. The headache comes on like a thunderclap, reaching maximum intensity within seconds. People describe it as feeling like their head is exploding or being hit with a hammer. This often signals a hemorrhagic stroke where a brain blood vessel bursts. The confusion part is equally serious. You might suddenly feel lost in familiar places, unable to follow conversations, or confused about what day it is. You might not recognize family members or remember simple tasks like making coffee. This is the most dangerous because many seniors think the headache is just a migraine and dismiss confusion as a senior moment. They take aspirin and lie down. But this headache means your brain tissue is either not getting oxygen or bleeding internally. The confusion means brain cells are dying right now. Here's your thinking check test. What's today's complete date? Where are you right now? What did you have for breakfast? Can you name 3 things you did yesterday? If you suddenly can't answer simple questions you knew an hour ago, or if you have the worst headache of your life, call 911 immediately. Try counting backwards from 100 by 7s, 100, 93, 86, 79. Try spelling your last name backwards. Can you remember your phone number? These are things you normally know automatically. Helen, 78, developed a crushing headache watching evening TV Thursday night. She told her husband it felt like being hit with a baseball bat repeatedly. She'd never had a headache this severe. She took 3 aspirin and asked him to turn off lights. She felt confused and couldn't follow the TV show. Her husband suggested she go to bed early. Maybe she was getting sick. Friday morning, when she didn't come down for breakfast, he found her unconscious. The CT scan showed a massive hemorrhagic stroke. The doctor said the headache and confusion were emergency signals. If they'd called 911 Thursday evening, emergency surgery could have stopped the bleeding and reduced brain pressure. What makes this tricky is they can happen together or separately. You might have severe headache without confusion or sudden confusion without headache. Both are equally serious stroke warnings requiring immediate emergency care. Never ignore sudden severe headache or confusion. These are your brain's emergency signals that tissue is in immediate danger. Now let me give you 3 things you can do today to lower stroke risk. First, drink water consistently throughout the day. Dehydration makes blood thicker and stickier, increasing clot formation risk. Keep a large water bottle on your counter and aim to drink it twice daily. Add lemon or cucumber for flavor if plain water is boring. Second, take a 10-minute walk after dinner tonight and make it daily. Regular movement keeps blood flowing smoothly and maintains healthy blood pressure. Even gentle strolling helps. If outside isn't safe, walk inside, room to room, or march in place, watching TV. Third, check your blood pressure this week. High blood pressure is the biggest stroke risk factor for seniors. Many pharmacies have free machines. Your pressure should be below 130/80 for most seniors, but ask your doctor what's right for you. Let me recap the 5 signs quickly. Number 5, sudden vision changes, like blurred sight or losing vision in one eye. Call 911 immediately. Number 4, slurred or garbled speech, where words come out wrong. Call 911 immediately. Number 3, sudden weakness or numbness on one side of your body. Call 911 immediately. Number 2, severe dizziness or loss of balance that makes you fall or grab furniture. Call 911 immediately. Number 1, severe sudden headache or confusion that's different from anything you've experienced. Call 911 immediately. Remember, every minute matters during stroke. Brain cells die quickly without oxygen. The sooner you get treatment, the better your chances of full recovery. Stroke treatments work best within the first 3 hours, but can be effective up to 24 hours in some cases. Don't be embarrassed to call 911 if you're unsure. Emergency professionals would rather respond to false alarms than have you wait too long. Don't try driving yourself. Symptoms can worsen quickly, and you could have an accident. If this could help someone you care about, share it with anyone over 60. It could literally save their life. We post 3 senior health videos weekly to help you stay independent and safe. Tap subscribe so you don't miss life-saving information. Your brain has kept you thinking and functioning for decades. Now it's time to protect it by recognizing these warning signs and acting fast. Which sign will you remember most clearly?